that's coming from Ayaan Moledina, who is 12 years old. And she asks that, I'm a volunteer for the American Muslim and Multi-Faith Women's Empowerment Council, and I'm the VP Ambassador Training and Activation for Teens for Vaccines. In states like Florida, there are no minor consent laws allowing minors to get vaccinated without parental consent. If parents are anti-vax, but the teen is ready to get vaccinated and they can't, how can people in these types of situations get the life-saving resources that can get us out of this pandemic? Why don't we start with Dr. Murthy? Any advice for Ayaan?
Well, thanks, Eric. And Ayaan, I'm so glad you asked that question, and how nice to have you on this call. You've inspired all of us with the advocacy and education you're doing in Texas. This is a challenging situation. There are some states where, a minor can go on their own and get a vaccine without parental consent, but there are others where that is not possible. And we know that there are individuals, young people who want to go out and get a vaccine. They're under the age of 18, but they don't necessarily have their parents' consent. This is a situation where engaging with your doctor actually can be quite helpful because having your doctor be not only a source of information, but an advocate for you, somebody who can also speak to your parents, talk to them about the power and importance of vaccination is extremely important. You may also find that in your school that there may be teachers and school administrators who may be willing to also engage with parents as well to help them understand that vaccinations for those who are 12 and above are not only good for their individual health, but they're a good way to ensure that our kids have a better chance at staying in school. And I know that all parents want their kids to be able to, but the vast majority of parents want their kids to be able to go to school and to stay in school. So I appreciate how challenging it is for young people who want to get vaccinated but are minors and require parental consent in some states. But don't forget that in your doctor and in your community of educators, you have people who can be advocates, who can be folks who can speak to your parents, who may be able to help them understand that there's science behind these vaccines. It's good for protecting our kids, and it's also a really helpful tool for helping our kids get back to their way of life.